Now we are going to talk how you are going to manage inside the room, how you are going to play your role in the communication skills station. Outside the room, you are going to have a paper with a scenario. I want you to read the task properly because this is the part that you need to concentrate on while you are talking inside the room. And you have a blank paper outside. You can write down your thoughts and arrange them. I want you to have a skeleton. I want you to enter the room and know what you are going to talk about inside, and to be the leader of the talk inside. First scenario we are going to talk about is the scenario of the adult polycystic kidney disease. It is a very common scenario, and your task will be to discuss the diagnosis and address the concern to the patient inside the room. We are going to talk about a female. She is 35 years old, newly diagnosed as adult polycystic kidney disease. Your task is to explain to her the diagnosis and your plan of management. At the beginning of the meeting or any meeting, introduce yourself in a clear, confident, and professional words, and confirm the identity of your patient. Then set the agenda that you are going to discuss with the patient, her medical condition. There are a lot of starting questions or open questions that you may choose whatever it is perfect for you to use. One of them, to ask the patient, how much do you know about your medical condition? Or do you have any idea what's going on with your health? Or how much you had been informed so far about your case? These are very important opening questions because, as we've told before, this is what we are going to build up our information. It is important to know how much your patient knows about his or her condition. And there are many people talking about whenever you hear the word 2 minutes remaining, go ahead and jump to ask for the concern, which is not a right way to manage in the communication skills. Maybe it is okay with the history taking, but in the communication skills, no. We need to ask the patient about his concern all through the scenario, because maybe he's got a lot of concerns. And by asking him all through the conversation, in this case, you may know what his concerns and address them properly all through the scenario. It is wise as well to explore if the patient has any specific expectations about his meeting, because in this case you can put his expectation into your consideration while you are directing your meeting. If you are going to explain a disease, as in our case adult polycystic kidney disease, it is usually nice to start with the physiology. Explain what is the function of the kidney as a filter, which is cleaning the blood from the toxins, salts, and excessive water. And then, second to the physiology, explain the pathology. And you can help yourself by drawing. Drawing is usually important. Draw the normal kidney, then draw the kidney after it is becoming enlarged and replaced its tissue by large cysts. And usually use a very simple English, layman language. Explain it in a very clear words so as not to mess up with your patient and drown him with the jargons that he will not be understanding what you are talking about and make him and the examiners as well upset from you. For example, explanation of adult polycystic kidney disease in layman language that the normal kidney tissues had been replaced by a large sac which are filled with fluids. These sacs compress the normal tissue of your kidney and affect consequently the function of the kidney, and in the same time make your kidney larger than it is, and this may lead to any minor trauma can cause these cysts to be ruptured and cause pain and the blood in urine as well. After explanation of the function of the kidney and what's happening about the adult polycystic kidney disease, it is important to stop. Make a stop in your words. It is not just a battle to show the patient and the examiner how much information do you know. No, it is just a tennis play. You give him the ball and you wait for the ball to come back to you. So ask the patient, do you follow me so far? Do you understand what I'm talking about? Do you think that I'm not saying something, I am saying something is not clear for you, or do you want me to go through with these words again? These are very valuable statements because it means that you are keen to make your patient understand what's going on. And this is what all the communication is about. Possible concerns in this scenario: the patient may ask you, is this a treatable disease? You need to be honest in telling the patient, unfortunately, it is not a curable disease, but we are going to try to make our best in control this disease and try to postpone the problem that you may develop from this disease. And here is the rule of the plan of management. The plan of management in this case would be simple things like advise the patient to drink a lot of water to make the kidney functioning well, and any medical condition or any comorbidities is associated with this case should be discussed in details. For example, if hypertension or diabetes should be controlled. Avoid exposure to trauma is mandatory, and this should be avoided by avoid any heavy competitive sports, and ask the patient about his own job. Maybe he is involved in a job where he is using his body, so inform him that the adult polycystic kidney disease make the kidney is larger than it should be, so exposure to trauma will hurt him and expose the kidney to the cyst to be ruptured, and so that there will be pain and the blood in the urine as well. The pattern of inheritance of adult polycystic kidney disease is autosomal dominant. What do you mean by autosomal dominant? In layman language, you can say that you have two genes. The gene is the code or the map inside your body, inside your cells, which carries your characters, and they transfer it to your children. Simply, you have two of them. One of them is healthy and the other one is affected. So each one of your children will have a chance to pick up the healthy or unhealthy gene, and consequently 50% chance to get the disease. Raise the attention of the patient not to deal lightly with any headache, because headache could be a sign of a presence of another cyst inside the brain or increase in the blood pressure, and both of them should be dealt with them wisely and urgently. Your patient is a female in the childbearing period, so asking her about future plan of pregnancy is important as well. Suggesting this future plan of pregnancy could be followed with the woman doctor, so as to find out if there is any problem during the pregnancy, for example, following the blood pressure. And maybe we can take the advice of the genetic counselor as well, because we can pick up the good gene and make it in contact with the sperm of her husband and returns back into her uterus. And by the way, the uterus in the layman language called womb. And by this way, we can avoid that the future child will have the 50% chance of the adult polycystic kidney disease. Last advice, don't forget to ask about the concern so many times all through the scenario. Listen well to the patient and address her concern, and be sure that it is her concern, not your own plan of management. Thank you.